What's your story? Whether you're a client or an independent financial advisor, we know you face many important decisions that can affect your and your clients' long-term financial success. Welcome to the WIN Podcast, What's Important Now with Corey Heimensen, accredited investment fiduciary and president of Heimensen Wealth Advisors. In this podcast, Corey helps you identify your goals and objectives through financial education and comprehensive planning, while inspiring you to make better behavioral decisions in your personal finance. With a twist on pop culture and current events, join us as we explore growth and protection strategies for individuals, advisors, and their businesses. Come and discover what's important to you now.
Welcome to the WIN Podcast with Corey Heimensen. Corey, I feel like today's podcast should come with a warning label, like, warning could be really scary kind of warning label, but an interesting one. I don't want anybody to run away from it.
I'm getting a flashback to like the MTV days of the Jackass show, where they had all the disclaimers up front, like don't try this at
There were
home,
like 14 disclaimers before they got into 3 minutes of program.
And don't send us videos of you doing stupid stuff because we're not going to put them on TV. So.
Exactly.
So yeah, I mean, we're going to talk some scary stuff, but we're going to bring it home, circle it around, make it pertinent, and have some fun while we do it.
Really and truly, there isn't a whole lot more scary than things that can happen to you in retirement, except that when you go things that can happen to you regarding medical cost in retirement.
Yeah, and that's a question I get repeatedly when people say, "Hey, what's the common question you get?" And I tell them, well, the 5 years before you retire and the 5 years after you retire are kind of that 10-year window that's super, super important to not screw things up.
Yeah.
And then into that, I always get the question that people are concerned about healthcare costs, in retirement through the end of their life. And that makes sense. And so the title of this podcast, and it really works best if you put your hands in your pockets and you shrug as you say it, and you say, it's just math. And now, I don't know if anybody out there did what I told them to do, but you just shrug a little and you go, it's just math. And so maybe math scares people, but we're going to bring this home that, if you think about breaking things down into manageable pieces, that's sort of what I'm talking about here, But,
all right.
So
let's get started then.
Yeah. So to kick it off, I did some research. There you go. And I grabbed some of these headlines off the internet. And so there's a common theme here, and so the first one is retirement nightmare. Skyrocketing healthcare costs leave seniors in financial ruin. And the next one, the scary truth about aging. Healthcare expenses haunt retirees.
Oh my gosh.
And then I found another one, haunted by bills. Why healthcare is in retirement's really a terrifying reality. See, there's a common theme here of like, it feels like you're watching movie trailers in October. You know what
exactly.
I mean? Like, what's in
yes, that's fair.
I don't know. And here's another one, retirement's dark secret, the terrifying surge in healthcare price tags. So I mean, we can go on and on and on, but I'll blame your old industry a little bit, the media industry. I mean, they want people scared, right?
Yes. No, absolutely. The thinking, which I disagree with, is people will not pay attention unless you scare them into paying attention to what you have to say.
And that goes right hand in hand with this, that in our industry, in the finance or the insurance or the healthcare type industry, you see these types of headlines, and maybe a lot of them are geared toward people that sit in my chair, but it'll come from an industry expert or from usually an insurance company that'll say, we estimate that the cost of retirement healthcare for a couple could be like $472,000. And they play that card to get people like me to think, oh my gosh, these people need insurance. They have to go buy long-term care insurance. They need to cover this. How do you have $472,000?
Yeah.
And then that's where the math kicks in. And I love this. This is like the light bulb moment, So, let's start breaking down that chunk of money. It might not even be an accurate number, but let's call $472,000 the number we want to try and solve for.
Okay.
For a couple that if you have two people in retirement, let's say retirement is equals age 65, and let's look at 20 years. Get them somewhere out there to that 85 age of, roughly ballpark life expectancy. You know? And so the easy way to start this is let's look at Social Security. So I back into that. I look up and see what's the average person in our country get for Social Security? $1,500 a month. Okay, $1,500 doesn't sound like a lot. Pay some bills. Okay, but my spouse gets it too. Okay, so now we're at $3,000, right?
Mm-hmm.
Times 12 months, 36 times 10 years. You get where I'm going with this.
Right.
$36,000 a year over your entire retirement suddenly is a number that, I can pay a lot of bills, whether they're healthcare or other things. And so where does this go next? This is exactly why banks exist. Because not many people go out and they buy a $400,000 house with cash in a shoebox. They have to break it down into manageable, bite-sized pieces.
Yeah.
That's why mortgages exist. That's why car companies finance automobiles, because if you had to go write a check every time you bought one for the whole thing, a lot of people wouldn't buy that car because they just don't save enough.
Yeah. And I get where you're going with this, but when you hear, let's just use your number. When you hear that $472,000 is potentially your cost, and then you think, well, okay, I can break it down and I can borrow the money. Well, then you're going to have to, that's still scary, Corey. I mean, that's a frightening kind of number to deal with. And I mean, I would add another word there is it potentially, because everybody's health is different. Everybody's healthcare needs are different. So, but I get where you're going in terms of stop, take a deep breath, and realize if you take control of this, if you proactively get involved, there are solutions at your fingertips. Is that where you're going with this?
Yeah, I mean, that's exactly right. That, that same industry that maybe tells advisors like me, oh, look at our product. Our product will help these seniors in order to have, let's say, nursing home coverage.
Right.
Okay, it's not that easy. You can't just write a small check and then get a huge benefit back later. Yeah. These insurance and annuity companies are capitalist companies. They want to make money, and they've got it figured out. And so we need to look at solutions of all this, because you can't just buy, for example, long-term care nursing home coverage that lasts for 20 years of coverage. It doesn't exist anymore because the companies figured out they couldn't afford to offer it. Even those types of products, maybe they fit for certain people, but they're a piece to the puzzle. And so, let's look at, things or ways or other solutions that might tie into the best potential. You said potential or probable. In planning, the best thing we can do is just make the best decisions we can to increase the probability of success, essentially. Right. Yeah. And that's from investing to tax management to, paying for bills that might or might not come down the road. Mm-hmm. And so that's where we need to go. And so I think the first thing you got to do here is wrap your mind around a long time horizon. Retirement can be decades for some. And like you said, there's factors, there's variables. Not everybody lives the exact same amount of months or years, and so we have a long time to accumulate funds for healthcare expenses now, today, but also in the future as we have cash flow that might be Social Security or coming from investments or other things.
Yeah. Well, it does underscore the importance of having savings beyond just resting on Social Security. I will give you that. Absolutely.
Right. And I am absolutely not here to say Social Security is meant to be your golden egg. No, it was never meant to supplement, or I shouldn't say supplement. It was never meant to cover your full budget of expenses in retirement. It was meant to be a piece of the puzzle to supplement it. And it's just a crutch that people use when they didn't save enough themselves. That's horrible. I mean, I'm probably going to offend somebody with that statement.
No, but I think that's a fair, accurate statement, though, because the original intention of Social Security was as a supplement. And the reason it was enacted, or the logic expressed at the time, was there are a lot of people who aren't saving. So we the government, are in effect going to force that savings. And so they created accounts so that when people retired, there would be at least some money available to them if they weren't, and that didn't mean they shouldn't save outside of Social Security. It was just a way of ensuring that there was at least a little bit of money for people.
Spot on. When I refer to Social Security income with clients, I use a highly technical internal term, gravy. Nobody needs gravy to survive. But you know what? It makes Thanksgiving a hell of a lot better holiday. Yep. To me, it's like the sprinkles on a donut. I mean, this is extra. This is a perk. This is a benefit. Let's enjoy it. And for some people, if that's all you've got coming in, I understand. But to your point, in a perfect world, people have built their own nest egg as well, or cash flow sources, or different things to blend all this stuff together.
Yeah. So what can people do? Because what can folks do? What kind of decisions can people make to prepare for this reality? Look, it is a fact. This is a fact. And I know this from having spoken with doctors over the years. The most amount of money that people spend in their lifetime on medical care comes later in life. That's a fact. So what can folks do to get themselves prepared and ready should things come along, and or maybe avoid having things coming along?
Yeah, I mean, I think it's a deep pool of answers. The first ones that come to mind, though, and this maybe isn't the fun one, is this is really a lifestyle choice type conversation. That you're right. Most people don't retire and get sick instantly at age 65 because of the calendar clicking off a birthday. Right. Like you say, a lot of the expenses, come later. Yeah. But let's go to healthy lifestyle choices. I mean, exercising more and having a better diet, and maybe being surrounded by other people and being social. Yeah, I don't know exactly what makes everybody tick, but I do know that there are habits that some people have that will catch up with them, whether that's eating too much red meat or eating too much, smoking, drinking, we can go on and on. But spending and saving and healthy life choices are kind of all things that get you a result or an outcome someday that you deserve, is maybe what I would say. And I'm not saying I'm the healthiest guy in town, but I do have an understanding that, making some choices today is going to affect some point down the road.
Right.
And so I think that's part of it. Put yourself in a position to succeed. And maybe that means going for a walk or doing some of these exercise things and diet things that maybe aren't super, super fun, but they're a good start. How about that?
Yeah, exactly. Choose to be in movement, if nothing else. Choose to move as opposed to being just totally sedentary. That's not even a really difficult thing to do. That makes sense. Yeah.
And, and I think hand in hand with that is just preventative care. Maybe that just means making sure you go in for that annual checkup and, just being aware of your situation. Don't put things off because they're probably going to get worse if you stick your head in the sand and avoid them.
Yeah. There's so many people that I've spoken to, because I go every year and have for decades for my annual physical. And I know people who look at me and go, "Why do you do that? Is there something wrong?" And I'm like, "No, there's nothing wrong." But I said, and there's nothing going to be wrong because I go in for an annual checkup. But, if there's something on the horizon that, maybe we can get an early warning on, that's good to know, right?
Oh, absolutely. This is kind of an aside but I sat by a friend of mine at a ball game last night, and he says, "Have you ever been to one of these hot rooms that you exercise in? I go, well, I don't even know what you're talking about. He's like, it's like 90 degrees in this room and you go in and you exercise. I go, on purpose? He's like, yeah, So, he says, I did 2 sessions. And he says, as soon as you walked in, they had like a rowing machine was one of the classes or something. He's like, you act like you're rowing that boat about 4 times and you're just drenched in sweat already.
Well, as a guy who grew up in Texas.
That's like Thursday for you, Bill, right?
Exactly.
Thursday in Texas.
Exactly. So I'm like thinking, I've been exercising in a giant hot room the whole time the whole environment was a giant hot room growing up.
Who'd have thunk you could have franchised that stuff back in the day?
No, really. I'm going to contact some friends of mine still in Texas and go, guys, we could monetize this.
But anyway, point of all that, I don't know what the point of all that is, but it was interesting to me. And, getting out of your comfort zone maybe is the point of all that. But
yeah, it is.
Another thing that people can do is look at a health savings account. If you have the right type of high deductible insurance plan through the years, setting some money aside.
Yeah.
It's going to help pay for either premiums or out-of-pocket costs later. Again, planning ahead, it's no different than on the airplane when they talk you through the safety speech. I know it seems repetitive and the same every darn time, but the point of it is to have you prepared for what could be a bad potential situation in the future. And that's really essentially, that can be healthcare costs too.
Tell me something, Corey. I'm always confused about health savings accounts. What are they?
So essentially what this is I'll take the easy part of the phrase first, savings account. You're putting money into a bucket that's meant for future healthcare costs. And so the government or the IRS sets restrictions on this. You can't just say, hey, I have $44,000 I can just put in my health savings account. No, there's caps per family per year.
Okay.
And since these podcasts kind of carry over year to year, I don't want to use an exact number, but we'll ballpark it, and say it's between 8 and 9,000.
The idea is that there is a cap in there.
Yeah, there's a cap. And so this ratchets for inflation every year, but I'm going to round it up a little bit for the current year when this podcast released, but let's call it $9,000 for a family.
Okay.
And so you put this money in, it actually gives you a benefit of being tax-free money in the future if you use it for healthcare related expenses. Now, honestly, that can be prescriptions, it can be copays, it can be premiums on health insurance if you still have health insurance when you retire, but you're not age 65 on Medicare yet. So it's basically a tax-free bucket that you can use for healthcare costs in the future. So it's a way to plan ahead to benefit yourself as part of the overall puzzle.
Is that something that's available to everybody, or does your employer have to offer it as an option?
Like many government type related rules and programs, you have to have a certain type of health insurance plan to allow you to fund your own HSA health savings account.
Okay.
Meaning you have to have a high deductible type health insurance plan. So it's in the weeds. It's kind of complicated. I shouldn't say in the weeds. That almost comes across as a negative or a
right.
Not legal thing. These are totally legal, but there's guardrails. There are rules and, definitions that have to be met. And so you either need to talk with a professional or your professional insurance agent to really see if it works for you.
Gotcha.
If it doesn't work for your situation, you can still always open an account, an investment account, and mentally we put air quotes up in the air and say, hey, Mr. and Mrs., this is your health fallback savings account. You know what I mean? You can always have an investment account for any purpose,
Gotcha.
Whether it's a vacation fund or a health fund or a kid's college fund. And I think that's a great way to save, actually, to set goals and build that way. I have one of these myself. So when my kids were younger, I set up, I'll call them 2 different goal accounts. One was for weddings, because I knew I'd be on the ticket for some wedding costs.
Yeah. And
the other was my future healthcare, So every month I throw money into each of these buckets, And I don't know, as I'm scratching my head, I'm wondering the cost of weddings versus healthcare. Which one's appreciating faster? I don't know. Depends on the venue, I suppose.
That's a race, man. I don't know. That's a race. It's a scary race.
But again, this goes back to where we started. If I think, man, I need, $300,000 in my own personal healthcare savings bucket. Yeah, maybe that's not in my checking next month to just write one check for that fund. But boy, can I put some in every month for the next 20 years until I retire and then have it to build and grow and go from there? Yeah, I'm doing the same thing I talked about at the beginning, using money monthly that's extra to invest it and make it productive for a long period of time and use it in the future. We've joked about squirrels, saving acorns for the winter. I mean, this isn't much different than that. I mean,
right. No, this makes total sense.
That's what we're here to do. Make really complicated things and break them down into sensible, easy to understand topics.
And you're doing a great job of it.
I wish we had a sponsor. If we had some kind of a sponsor that paid us advertising, that would have been a great spot to let them make a point. But we, oh man. But setting some money aside, then this ties into other things like we haven't even touched on inflation. Inflation can be an increase in costs of things, but you can have income or wage inflation too. So, I mean, a lot of people get raises every year, right? So, I mean, and Social Security gets raises. So, I mean, earlier our example, if a couple's getting $3,000 a month, they do get an inflationary increase a lot of years. So their money coming in for Social Security is going to go up. Mm-hmm. I understand the healthcare costs are going to go up as well. But I mean, you just have to put things in perspective on the teeter-totter that it can go both ways from an expense or an income type perspective. So, just something to think about. And honestly, when we invest, history shows that you have more months that go up than down, and so getting these dollars working for you, whether it's a health savings account, whether it's your own mentally earmarked bucket for healthcare or a wedding or funeral or whatever you want it to be, investing works if you give it time.
Yeah. Yeah. Which is, and this is a conversation that people need to, well, I guess they need to initiate it with themselves first, but then they should sit down with their financial advisor and have that conversation.
I think the conversation happens in three places. I think if you're a married couple, you have it together. Mm-hmm. And then step two, or maybe step one before step two, is looking in the mirror and being like, I'm aging. I'm not the same person in the mirror that I used to be. And I need to account for that. And so between my spouse and I, we're going to talk it through, and then we're going to go get that trusted professional on the team of the, three-legged stool or whatever you want to call it, and figure out what the best path forward is. Not everybody can afford to put all that money in a health savings account. Not everybody can afford to save piles and piles, but can you save a little? Can you make a small incremental step to improve your future outcome? Hell yes, all day. And if you go a step further, I mean, in our country, people that can't afford for Cadillac type insurance or Cadillac type facilities in the future still get taken care of. You know what I mean? I'm not saying we need to all rely on government programs, but there are programs in place that basically say, we're not going to make you homeless if you can't afford healthcare or a nursing home or a facility type outreach.
Yeah. No. There is of course Medicare, and then every state has a Medicaid fund which they manage and distribute according to the state rules and regs.
And I get it. A lot of people maybe don't want to spend time in a nursing home or a facility of those types, but it's not prison. It's not. You know what I mean? There are worse things. There are absolutely worse things. So, it comes down to each person's attitude, probably too.
True.
Because I know people that could afford to have private in-home care, and yet they've went to a home and they actually like it because there's camaraderie. There's people there in a similar situation or a peer group.
Yeah.
So, I mean, we shouldn't just paint a brush and say healthcare buildings and facilities are bad. No, there's a lot of good ones, and there's a lot of good workers that care, and boy, hats off to them. We need those people.
Yeah, I agree. But it's interesting because to your point about this entire episode is that yes, this is a significant cost. Whatever that number is going to be, it's a significant cost. But you can prepare for this. You can get ready. And if the cost is less than, the average cost, then you're ahead of the game. You're better off for having been prepared and not having to use any of that money, because then that you can make decisions at that point about how you're going to distribute that money later in life or when you're gone.
That's exactly right. And my wife and I have friends that have done some mountain climbing around the world. And they say, Corey, you and your wife, you should come along. We should go do this climb. And it's like, initially you think, well, sounds kind of interesting. Mm. And then you realize you don't just show up and climb a freaking mountain in 2 days. You know what I mean? This is some of these bigger ones around the world. You're talking like a 3-week venture.
Yes.
And you have people guiding you and helping you. And the reason it takes that long is if you bite it off in manageable pieces, well, basically your heart and your lungs don't explode, but it makes it easier to accomplish, And honestly, I think that's what came to mind here. I didn't even have that note written down, but that's what comes to mind here when you say, yes, this healthcare future pile of money that I may lay out is a really big pile of money, but it's manageable. It's like climbing your mountain. You can do this if you take steps today and plan ahead and just understand that there's outcomes we can't exactly know the way it's going to shake or what it's going to cost or how long it's going to last. But man, if I take the right attitude and I have the right groundwork in place, my odds of succeeding are pretty good. And that's all you can ask for.
It is. It is. For listeners who have enjoyed this conversation, Corey, what's the best way for them to reach out to you? I realize some of the folks might have their own financial advisors, and that's fine. But if they want to have a conversation with you, how do they get a hold of you?
We have a lot of technology here, but we're pretty old school. We like to talk to people on the phone, Bill.
Whoa. You mean I don't have to scream at a bot?
It's like one of these things that where you put your finger on a number and then you dial it to the right clockwise. No. We're a little more modern than the old dial phones.
Boy, that gave me a whoa, wow.
Oh, man. I'm old school.
That was back to the past.
Back when phones were connected to a cord in your house, man. Okay.
Oh, Lord.
Give us a call out there. Our number, 800-657-4316.
Great. And you just sparked a memory that I'm going to share before we get out of here. I remember finding a rotary phone I think it was stored away in a basement or something. And I brought it up to show it to my kids. I said, look, it's a phone. They're like, how did that work? and I said, can't you figure it out? And I left it with them. It took a long time for them to realize, and I had to show them. I said, here's how it worked. And they were fascinated.
Oh, man, that's great.
So, yes, great. Reach out to Corey. Call him. Talk to the folks in his office. Everybody at Heimensen Wealth are terrifically friendly people, and they will be glad to help you. The other thing you can do is, if you're not a subscriber already, just subscribe to the podcast. Hit the subscribe button. That way you don't miss any more of these conversations, which I'm sure you do not want to do. And if you're so moved, if you like it, give us a rating and then share it with other people. Help spread the word about the podcast. Thank you for listening. I'm Bill Tucker. On behalf of Corey and everybody at Heimensen Wealth, thank you for listening. And remember, do not wait to live your best life. Go out and live it today. Thank you.
Thank you for listening to the WIN Podcast. What's important now? The show that helps you achieve your financial dreams. To ask questions about topics covered during the show or get a copy of Stop Doing Dumb Things with Your Money by Corey Heimensen, visit www.heimensenwealth.com or give us a call at 712-472-3867. Don't forget to click the follow button below to be notified when new episodes become available. Securities offered through Securities America Inc., member FINRA SIPC. Advisory services offered through Securities America Advisors Inc. Heimensen Wealth Advisors and Securities America are separate entities.